Good morning, everybody. This is our EBTR webinar for June 22nd, 2017. We are excited for our subject today. It's going to be on active transportation options and kind of the health benefits with doing that. So we have two presenters, Brett Mix. How do you spell say your last name, Brett? Sorry.
Macif, but I've been called so many things
Macif.
I'll accept anything.
I apologize. And Phil from Bike Utah. So we're going to start with Brett first, and we'll go from there. So take it away, Brett.
Thanks so much. This is a fun opportunity to do a little bit of preaching to the choir, because we get a lot of people who say that there's a real drive, pun intended, towards getting people to use active transportation more, but we're not exactly sure how we're going to make that leap. So, for instance, as I work with a lot of our local governments and with a lot of other agencies, we talk about how can we help get your employees using either their feet or a bike or some combination or combining transit and really making a difference. So when I put this presentation together, I decided to go for the ever so subtle title of How Walking or Biking to Work Can Save the World. And I don't think it's entirely too bombastic, but I think it actually has some levels of truth to it. The first question that we ever get, whenever I'm in a meeting, I'm often meeting with groups like Phil's group or with a lot of our planning and engineering team, they look at me and say, well, but why health? I mean, this isn't so much of an issue, is it? And interestingly enough, it really is very dramatic how much of an impact that a little bit of physical activity during the day can make. Coming from a health perspective, we are obviously very concerned about topics of air quality and how that can obviously impact not only our general population, but particularly our more vulnerable populations, older adults, very small children, and especially when we realize that those are the populations that tend to go for a walk in the evening, whether in a stroller or walking as a small group you see in the picture we see here, that are going to be affected more often than not. We're also coming at it from an interesting angle with injury prevention, and that most of our injury prevention people say, hey, the best way to make sure that people don't get hit while out on a walk or a bike ride is to not let them get out there. So we have this challenge, this pull, this dichotomy of, well, let's keep everybody safe, but at the same time, from a health promotion perspective, we know that if we can get people out, we're going to have dramatic impact on our overweight and obesity issues within the state, as well as the things that are more dramatic and more impactful of heart disease, stroke, diabetes, certain types of cancer, asthma, arthritis, et cetera, et cetera. So this is a real major topic for us. Coming from a state health department, we're looking at how we can help support a lot of our local communities in building environments that are much more supportive as opposed to those places that have prioritized cars for so long. I sometimes get in trouble when I show this picture, but I found this one as I was wandering about. I believe I was up in Portland, and no surprise there. But I showed a picture of a car saying this one runs on money and makes you fat, and a bicyclist says this one runs on fat and saves you money. But it really comes down to it that when we're talking about issues of transportation and access, we're really talking about health. We're talking about both health equity, health access, health issues that really can make a difference for all of us. But let's get into some numbers, because nothing says fun like a chart or a graph. So let's look at the information that we have in what's called the indicator-based information system on health. And we collect a lot of this information through a telephone interview style, where we actually will do a random digit dial and contact people all across the state. And we ask them to answer a few questions about their health. One of those is, how much physical activity are you getting during the day? And through ways of figuring all this out, we extrapolate to say, are they meeting the recommendations? What you see on here is a relatively flat line since about 2001. If I extrapolated that back even further into the 1960s, you'll realize that it is about as flat as Kansas can be. So we're not seeing a lot of major changes. But we do have a little bit of change where we started to ask the question a little bit differently. And in asking the question, we got everybody all excited. Well, yes, I'm including things like gardening and what kind of activity I do during the day. But we find that it's surprisingly staying flat. So rather than say we're not doing things that are making a difference, we start saying, well, what is happening and how can we make an improvement to make it much more inclusive of everybody? One of those things is, in the past, we prioritized participation in things like going to the gym, making sure you're out there with whatever leg warmers and et cetera, attire that would just make you look awesome. And now we've switched towards more of an environmental and policy-based approach to address much more of a public health approach, much more population health involvement, and saying that we can actually have an impact. Unfortunately, we're going to see it takes a little bit of time to influence these rates. One thing that is making a big difference is that not that far back, goodness, was it just last year? About last year, we started to see the Surgeon General's office released a report called Step It Up, a call to action on promoting walking and walkable communities. This was a major leap forward for us to be able to say that the federal government has placed, at least from the health angle and throughout all the associated departments, that walking and walkability is a major priority in affecting our actual health outcomes in the U.S. This one was different because it didn't just say we need people to walk more. It said we need to walk more by encouraging environments that make for walkable environments. It makes it easier for us to actually get out and do what we need to do. So rather than telling people to pull yourself up by your bootstraps, be healthy, or just go out and go for a walk, we need to make sure that we're dealing with things saying, but you have a place that you can walk. So that's been a major help. In the over the last couple of years, we've asked this question on our random digit dial surveys to find out a little bit more about active transportation rather than physical activity. And in this, we asked over the last 30 days, how many days did you walk to a destination other than for recreation or exercise? And we found that this wonderful 0-day category just overshadowed everybody. So it said that there's not a lot of people doing it. But those people that are doing it, we're starting to see, as a result, that their health outcomes are improving. We said, well, okay, that's walking. This is a great state. We've got a lot of really good opportunities for bikeability. What can we do to make that a little bit different? Well, in that same question, but changing it, how many days did you bike for transportation purposes? And no surprise, nearly 90% of people said that, no, that's just not what we do. And those people that were, we see often many of them doing this year-round. So we're finding out that there's a lot going on when it comes to active transportation. In particular, how do we get people to work? Now, I'm sure we've heard this one before, but it's not just the people in Lycra that are going to be riding. This is a big issue for all of us, and we want to make sure that as we're working to improve these environments, that we're helping everybody. Now, this picture that should be popping up on your screen in a second is something that's right outside my office. As I was parked at the light ready to turn, I saw this gentleman riding. And this is not a person dressed in Lycra. This is not a person who may not or be even traveling for work, but is traveling because he has daily activities that need to be addressed. I don't think I would recommend you bike with a shopping cart. However, I was rather impressed that he was able to do it and not crash. This is going to be where we're coming at it from, in many cases, a health perspective, is that this is not just a convenience thing or a nice to have. This is a need to have. And as we have some people who have only one option, or to walking or biking for their mode of transportation, we realize that if we can address things that will make walkability and bikeability be easier, we've made it easier for everybody. So not only are we going to have the people in Lycra, we're going to have the people who are going to the corner market. Okay, I want to switch over to one thing that many of you have probably seen before, and this is a chart showing how many miles are traveled in the U.S. Compared to adult obesity. They're in the blue, and childhood obesity. There's nomenclature, but we'll call it childhood obesity. They're in the pink. And we can see there's a wonderful match between the number of miles that are traveled in the U.S. and the relationship to weight and overweight. This isn't a real surprise, and I worry that we're showing things that may not be what everybody expects. We can also see the same chart showing that the more health clubs there are in the U.S., we've seen more obesity as well. So I can't blame vehicle miles traveled on obesity. However, there is such a strong relationship that we have to make sure we're able to say, is this what's happening? Is it the actual traveling that we're doing, or is it the environment that requires us to go for a longer distance to get from point A to point B without having that ability? One thing that we've also looked at is how the use of transit can be a major benefit. We know that about 30% of people who use transit hit their recommended amounts of physical activity just by walking to the bus stop or the train or some combination of that. Okay, now the nice part is that we're not necessarily locked into a world that says you will never be able to ride a bike here, you'll never be able to walk here. We have a lot going on, and I know Phil's going to talk quite a bit about what's actually happening and how we can really build on some of those. Now, as you're driving through downtown Salt Lake or riding your bike or walking, you're going to notice that there's a lot of these sharrows, there's a lot of these signs that will say, yes, bikes are prioritized here. This is a good thing. It's a start. Now, there are a lot of people who really want to ride. It's a matter of comfort for a lot of them, and the issue of having to share the lane is a wonderful thing. It says that, yes, we want to do it. We just haven't quite got there yet. How can we make it better? My hope is that as we get more people recognizing the benefits of health and how this can be a stealth approach to meeting your amount of physical activity that you need during the day, then we'll be able to see more people riding and taking that pressure off. So again, giving a comfort level when you've got a pack of people, as you might find in, say, countries like the Netherlands or throughout Belgium, you'll see that it's so many people biking that almost the cars are the second priority. What we have also been looking at is that not every place is as supportive. And yes, while this is definitely not Utah, I believe this was Georgia, where it says hikers and bikers move to the side of the road when a vehicle approaches, regardless of those wonderful creatures begging some attention. We do have a lot of support in this state, and that means that we're able to use the resources, the bike lanes, basically ways that are supportive for physical activity without having to fight a lot of these things. Some people say, but it's Utah, there's just so much snow and it's so cold, and yet we see so many of our cyclists that are year-round cyclists because they've been able to overcome that. How can we transfer from all those confident people into more of the people who say, maybe I'm not as comfortable with this, what can I do? So our goal is to reduce as many of those barriers as we have and to just facilitate a lot more access. One thing that we find pops up more than anything is that a lot of us want to refer back to obesity when it comes to talking about health outcomes. And while we can make a very strong relationship between the amount of time that you're spending in a car, it is directly related to the risk of obesity. And vice versa, when you switch over to more of an active transportation modality, you're able to say, this is going to affect our weight. But I wanted to also highlight that it's not just about weight, that the benefits of physical activity that you would get from riding a bike or walking to work are going to be more pronounced for other things, such as the heart disease risk reduction and the reducing of risk for diabetes and the effects of that. The physical activity benefits are completely independent of weight, but we know that we have some of our stronger arguments when it comes to that as well. So what are we doing to make it a little bit easier? For instance, this is here at the Utah Department of Health. We've installed a new bike pad with parking and a repair station. You can almost see there on the right side of the screen. A bench, a place for everybody to take the time, comfortably get into whatever shoes they need and repair the bike, because it seems like every time I ride I tend to get a flat, so I really appreciate the Fix-It station. This has become a priority for us here at Health, and we're hoping it becomes a priority for all the businesses throughout the state, because when you have the organizational support that says this is important to us, we're going to see a lot more participation. Another way that we've been able to see a lot of support for physical activity and active transportation, particularly when it comes to during the workday, is the use of these e-bikes that provide a little bit of assistance. This is an option for people who maybe aren't as strong as when it comes to fitness level and are looking for a way to get there or want to expand their range. These two bikes actually are part of our fleet vehicle system here, so you can either check out a car if you need to go to a meeting, or you check out a bike. And we're starting to see the use of the bikes picking up and being very, very popular, actually. And we're seeing, especially when we have so many governmental agencies that we visit in a close proximity. I actually took one of these out to a press event that was out in South Salt Lake, and it was a fantastic ride. This slide switches over. So for us, as we see the supports that are there, I don't want you just to think about, oh, this is just a convenience way or it's easy. We wanted to remember that there's a lot of health. So when we say something about the biking or walking to work can save the world, it may sound a little bit out there, but it really does make a difference, both when it comes to the amount of reduction of emissions that we're putting forth, as well as improving the health of the population as a whole. So hopefully we can all be a bit of superheroes. And while I had to grab this one out of a picture out of the UK, I think we should probably spend a little bit more time thinking about cyclists as heroes and less as challenges for big trucks. We want us to make sure that we're connected and that we're a part of this. So if there's anything that you have questions on, I know we've got some time near the end to go through any questions, but that's what I wanted to talk about when it came to health. So thanks so much for a chance to share what we're working on.
All right. Thank you, Brett. That was great. We will have some time for questions afterwards. So if you have any questions and you're online, go ahead and pose those, and we will get to them at the end so that you can you'll be able to remember them. Okay. The next presenter is Phil from Bike Utah. And take it away, Phil.
Okay, great. Well, thank you so much for the opportunity to speak with everyone today. I just wanted to talk a little bit about bicycle advocacy and tell you what we do at Bike Utah and how employers can maybe implement some of those practices into their own business. Just to tell you a little bit about our organization, Bike Utah is a 501c3 nonprofit. We deal with all types of bicycling, whether it be transportation, road, mountain, youth and family. And basically what we try to do is encourage more people to get out there and ride bicycles. We also try to work on improving the safety for those people who are already riding out of choice or by necessity. Let's see if my slide switches over here. So basically what I wanted to talk about today are these three things: why bicycling, the future of mobility, and what employers can do. And there are a lot of different reasons for why bicycling, and Brett obviously focused on the health aspect of that. But one of the key things also is safety. When bicycle infrastructure is put in on roadways, roadways actually become safer. You get reductions in motor vehicle crashes and speeding. Obviously, when you have bike infrastructure in place, it creates a little bit more of a separation between vehicles and cyclists and pedestrians. So everybody actually feels significantly safer on the roadway. When you have more, this is a chart out of New York City, and they've been doing a phenomenal job recently of putting in more bicycle infrastructure. And when you have more bicyclists out on the roadway, actually, it makes it safer, much safer for bicyclists. You would think that as you look at the blue bar compared to the yellow bar with injuries, that the number of injuries would go up proportionally with the number of cyclists, but actually that's not usually the case. And this is found in other countries as well. As you can see, the yellow bar, or excuse me, the bars going across are number of injuries, and then the green line is number of cyclists. And there's really two reasons why this is the case. One, when there are more cyclists out there on the roadway, drivers become more accustomed to seeing bicyclists. So they know that at a turn, at an intersection, the odds of them coming across a bicyclist are going to be quite a bit higher. In addition to that, when you have more people who are out there bicycling, the odds of a driver also being a bicyclist are quite a bit higher. So so those people understand the needs and demands and safety concerns that bicyclists will come across. Oh, I apologize. My computer is trying to update some information as we're talking. Sorry, I skipped ahead too far. And really what we're seeing is a change in how cities are built. There's a big movement recently towards what are called 8 to 80 cities, so that you can build cities that are better for everyone from 8 years old to 80 years old. And if you do that, if you can make kids comfortable and you can make senior citizens comfortable, whether they're walking or biking, everybody in between has a much better opportunity to walk and bike. And this is really common, especially amongst kids. We've seen a really significant shift in how children are getting to and from school. It used to be the case that many of them were walking and biking, and fewer were taking private vehicles, and this is virtually reversed in the last 40 to 50 years. In addition to that, AARP is looking at how can they create livable communities. How can we create communities where you don't have to rely upon a motor vehicle to live your life, to go get groceries, to get to a hospital or school or a community center or park. And really we have a great opportunity, especially in Utah, but nationally, in that most of the trips that people take are actually within a distance that's easily done by bicycle. And this is statistics from Utah of people's trips, and more than half are less than 3 miles. In addition to that, we see the bicycling and walking as kind of inextricably linked with transit. We understand that most people, if they're in Utah County and they're trying to get to Salt Lake County, they're not going to do that solely, obviously, by walking, or more likely not by biking. But if we can provide connections from their home to a transit stop, or from a transit stop to their final destination, it makes the entire system work quite a bit better. And really, transit agencies in Utah, especially UTA, they rely on walking and bicycling. They're not able to get to everybody's front door or to their office. So those 3 types of transportation modes really work together in concert. And just to give you some examples, Copenhagen has done a cost-benefit analysis to find out what the benefits are from bicycling to their community, and they found that driving, based on road wear, travel time, climate change, air pollution, you name it, cost their society 17 cents per kilometer, and bicycling earns society, based on those benefits, about 18 cents per kilometer. So really, I want to talk about what the future of mobility looks like, and it's going to have to make a change in the coming years. Here in Utah, this is some target projections for what the population growth is going to look like in the next 30 years or so. And most counties in Utah are going to see significant growth, some even doubling in population. And that's not going to be a great movement forward. And this is something I like to talk about quickly, using more technical terms, is induced demand. And a great example of induced demand is I-15 at the point of the mountain. UDOT just did a great expansion. The road's beautiful, and still, if you go there at 4 o'clock in the afternoon, it's still bumper-to-bumper traffic. And this is not really a circumstance that we can build our way out of. UDOT has absolutely had conversations about what it might look like to double-deck I-15. And I think most of us, from an air quality perspective and a quality of life perspective, don't want to see us go down that path necessarily. But we need to start finding other alternatives. The good thing about induced demand is that it works the other way too. We've seen countless examples from other countries, as well as in the U.S. and in North America, of communities building bicycle infrastructure and the number of people using that infrastructure and riding bicycles skyrocketing. And this is an example from Calgary, who I think we could all agree that Calgary's weather is significantly more challenging than it is here in Utah in terms of winters. And they've still found a way to drastically increase the number of people riding bicycles just by creating the infrastructure that people would like. And people always ask me, well, Europe is Europe, but really things have changed in Europe because people demanded it. In the 1970s, Europe and the United States were pretty much on the same track especially after World War II. There was a growth in the number of people who were using motor vehicles. And finally, the people in Europe, in Copenhagen and Amsterdam and in all these cities where you have 30 to 50% of citizens biking to work, they basically said, we're going to build the infrastructure for people to get around safely, whereas in the United States we shifted and said we're going to treat bicycles as cars. And you can see from the percentage of people in Europe who ride bicycles how well it worked there versus how well it worked here in the United States. And here's just one example of what that looks like. And that sign says, bicycle street cars are guests. So they have streets that are geared towards people riding bicycles, and as a result, there are a lot of people out riding bicycles. And really this is a change in who we're building for, and Brett alluded to this a little bit. Right now, the way we build bicycle infrastructure in the United States primarily, and in Utah as well, is we're building for these 1% strong and fearless riders and these 7% enthusiastic and confident riders. So every time someone puts in a typical bike lane that's 5 feet wide with a strip of paint down the side between the bicycle and cars, that type of infrastructure is really geared towards that 7% and that 1%. And now the big focus in terms of bicycle infrastructure is shifting to this 60% of riders who want to ride but are concerned about safety. And this is true from a bunch of other studies as well. And in Utah, the National Household Survey shows 53% of Utahns want to ride their bicycles more frequently. And so the infrastructure is changing to meet that demand. That top photo is a protected bike lane where there's a complete separation between pedestrians, bicycles, and cars. You've got multi-use pathways which provide physical separation, and you've got dedicated infrastructure like this bicycle signal where bicycles can go, and it prioritizes bicycles and gives them safe passage. And really the reason I've been talking about infrastructure a lot is because that's really a significant portion of what encourages people to ride bicycles. We, like Utah, do a lot of education and encouragement, but we know deep down that you can encourage people and incentivize them all you want, but if they leave their household and they go outside and there's 4 lanes of traffic going 45 miles an hour, most adults wouldn't feel comfortable, and definitely no children would feel comfortable in that situation. So we're really trying to make those changes in infrastructure so that, yes, as we encourage people and educate them and incentivize them to get out there and ride bicycles, they can go outside of their house and get where they need to go with infrastructure where they feel comfortable. So really getting down to what you can do. One of the biggest things for us is identifying the champions. And I'm sure most employers have those people within their businesses every business I've ever come across has at least one person who's the bicycle person. And those are going to be if you're not that person, my first suggestion would be figure out who that person is or who those people are and get them on board with trying to help create changes. They're the ones who are going to be able to put in the extra time and effort to help in creating changes. And then I look at internal opportunities, and there's kind of a differentiation between internal opportunities and external opportunities. And internal opportunities are things that your business or agency can do internally on your property or in your building that will help to change the environment for people who are interested in bicycling or walking. And one of the first things that I usually recommend to people is to do a commuter survey if you haven't done one already. This is one of the slides from one that was done by the state of Utah, actually, for their employees. And you can't measure and determine what needs to be done unless you know where you are. So this is a really great way to figure out what people are doing, what they might be interested in doing in terms of changing their transportation behavior, and then what are the steps that you would need to take in order to help facilitate that. So helping to identify some of those barriers that are identified on this slide. And then in terms of figuring out specifically from an active transportation perspective, what are those things that you would need to do in order to create an environment where people are more comfortable walking and bicycling. And you look at this one and obviously there are some things in here, showers, safe bicycle storage, that you can influence internally, and there are others like safe bicycle route from home to my workplace that you can't influence directly, but you can influence indirectly, and that's kind of what I want to get on to next is what are those external changes. And as an employer, as an agency, as a business, you're in a really great position to help facilitate that change. This is a list of a lot of the partners that we work with on a daily basis, and many of them are very receptive to helping to make changes in infrastructure. We work with UDOT frequently, and if there's a UDOT road in front of or adjacent to your business or agency, they are often willing to put in bicycle and pedestrian infrastructure, but they need to hear from people and businesses that are interested in having those changes made. If people who drive cars are often a lot louder, and there are right now more of them, so we need employers to help speak out and say, this is something we want for our employees so that they can get around safely, and we can encourage more people to walk and bike. So I would. And this is one of the things we do at Bike Utah is help to facilitate these types of discussions. So if people are interested, I have my contact information in the slide in a little bit. If there are connections that you would like to help us make, this is what we do. But like I said, UTA is really involved, the Metropolitan Planning Organization, local health departments. National Park Service has some programs actually even outside of their national parks that help to facilitate more active transportation. So I'd be happy to work with anybody to help advance those discussions. And this is one of the things we're working on here at Bike Utah right now is called Wasatch Bike Plan. And this map, I will say, is just a little bit out of date. But one of the things we're working on right now is trying to get every Wasatch Front community to have an active transportation plan. Most of our lives do not stop at municipal borders. If you're going from Murray to South Salt Lake to Salt Lake City, it doesn't matter whose border you're crossing. It matters if your bicycle infrastructure continues once you get from one municipality to another. So this is another place where people can be involved if you are in one of the communities that does not have an active transportation plan that's being actively pursued. That's a really great first step, and we're always looking for businesses and more constituents and stakeholders to be involved in pushing municipalities to pursue active transportation plans as well as the implementation of those plans. In addition to that, we have local groups. We have the Salt Lake Action Group, which is a local chapter of Bike Utah, and what this group does is work on spot improvements for bicycle and pedestrian infrastructure. So an example is if you look at that map on the right, there was recently a push on the McClellan Trail in Sugar House in terms of what that section of the trail was going to look like, and there was some discussion about, well, there shouldn't even be bike lanes. So our group kind of jumped into action and worked with a bunch of stakeholders and community members and citizens to really push Salt Lake City to create bicycle infrastructure that was safe and that encouraged people to ride in those neighborhoods. So we basically, when we see opportunities like that or people identify problems along their commute or along their in their neighborhoods, we work with them so that they can create campaigns to help create on the ground changes, because as I said, I mean, infrastructure is really the key piece here. And then also I just wanted to mention this as well. We have just wrapped up, along with numerous partners, including the Utah Department of Health, UTA, UDOT, an active transportation benefits study. So this is a comprehensive study looking at the benefits that bicycling brings to the state of Utah. And we haven't officially rolled it out. It should be in the next week or two that it officially rolls out. But one of the things that it has is it has a bunch of calculator tools, but it also has some health benefits associated with that. And we've found this one is really great in terms of actually monetizing what the benefits are for people getting more physical activity by biking or walking. These are numbers specifically to Utah for every, mile, $3 for every mile walked, and 75 cents for every mile bicycled in savings for people in Utah. So, but I'll be sure to share this with Matt and get that sent out to people as soon as it's ready to go. So really, I mean, just to kind of wrap up here, and I'm looking forward to some questions. But we basically work to get people out on bicycles and riding and keeping them safe regardless of why they want to ride. As I said, there's more than half of the population in the state of Utah is interested in bicycling and walking, and we just see that as a huge opportunity to be taken advantage of. We just need more partners, more employers to be actively promoting that both internally and externally. So with that, there's my contact information, and I'm more than happy to work with any folks who might be interested.
All right, thank you, guys. Thanks, Phil. Are there any questions from the group?
I have one. This is Ian from Ogden. I noticed on one of your slides in terms of what can we do to encourage people to walk and bike, and there's a stat on I think access to an electric bicycle would encourage, I think it was maybe 5 or 10% of the riders to do that. And I have one. I got one this spring, and it wasn't a physical limitation as much as I was finding I'd get home from my final ride of the day, which is all the way uphill. It's about a 35-40 minute ride. And I would cough for the next hour because, yay, we have the inversion season. So I ride every day regardless of weather. And so I guess I'm one of those 1% people. But I find the electric bike really helps with the air quality issue in terms of it reduces a 35-minute ride to 11 minutes, and you're not working that hard. So you don't cough for an hour, even with a mask on, which is helpful. But what I've also found, and this is strictly a marketing issue, is that when you explain what the bike is good for and how it serves people's needs, that's one thing. And they go, wow, that sounds pretty cool. When you let them try the bike, they're like, oh my God, I got to get one of these. This is awesome. I mean, it's a really strong sort of evangelist opportunity in terms of getting people to try something that they think might be okay, but until they actually do it, and then they're like blown away by how effective it is. And the first negative comment I typically get is, well, doesn't that mean you're not getting exercise? It's like, well, what I find is when the air was lousy, which is a lot, I would take the electric car with the bike in it to the train station in Ogden, and then I would ride at the Salt Lake end. And now I find with the electric bike that I'm willing to ride anytime, anywhere, any condition. So I'm riding significantly more days per year having an electric bike and getting more exercise in total than I was just riding my regular bike. It's like, it's counterintuitive. So it's one of those things where I think we're really underselling the opportunity, and the fact that the bike industry in Europe is seeing something like 40% of their bike sales are e-bikes instead of regular bikes speaks to the fact that it really works as a commuting tool, and it also works for couples who are typically divided by a guy who's ridden his whole life and is an avid cyclist, and the wife, not to be sexist about it, hasn't shown the same interest or just has chosen not to do it with him or does it in a different rate. If you get the wife an electric bike, she can set whatever amount of juice she wants to add and keep up with however fast he rides for as long as he wants to go. And they're finding couples in their 50s and 60s are taking up biking as a couple, even though it was always his deal. Now it's a unifying thing as opposed to a dividing behavior, which is, to me, a huge asset.
Ian, I'm on the same side with you. I think e-bikes are about the coolest thing they could ever have out there. And that may come from, I'm not your traditional cyclist. I wear a tie to work every day, and I don't necessarily want to have to change. So for me to have that little bit of an extra range and a little bit of extra oomph, and more importantly, the safety, I feel like if I need to have a little extra juice taking off from the line, I keep up with the cars as I'm migrating over into a bike lane or into a safer lane of travel. My favorite time was when I was riding from downtown Salt Lake out towards the health department here on North Temple, and I was able to give a little bit extra help as I went up over the North Temple Bridge, and I actually had a coworker who was driving pulled me over in the parking lot saying, that was the most amazing thing. You just took right off, and I felt just as comfortable having you there because I didn't think you were going to all of a sudden stop on me. So I think that perception of safety is also a very powerful thing.
I'd agree. Yeah, I got to be just from a fun factor. I really don't mind red lights anymore. Like, oh, look, a red light. Darn, that means I get to accelerate. Yay.
Exactly. That's the fun part. It's like taking off in an airplane.
It actually is. Yeah. So I think there's opportunity out there working with the bike shops who right now I think are marketing in their traditional approach, which is to have the stuff in the store, and people who are already bike enthusiasts, meaning the 1 in 6%, come to the store and go, wow, isn't that cool? And then people like me do the math and realize, wow, I could sell my truck and buy a bike, which I did, and I'm ahead. But for the 60%, they don't ever get a chance to get on it. And so the trick is to bring those bikes to farmers markets or other public events where the 60% is there and say, here's a helmet. You need to try this. No, really, you need to try it. And like, whoa, that is awesome. I think that's the way to get people on it. And then they become advocates as opposed to couch sitters.
Well, I would add to that, there are at least five shops in Utah that primarily deal in electric bikes. And they're on the outside looking into the rest of the bike community. So I found that they are far more willing and able to bring their bikes to people. So if there are employers who are interested in having them come out, I work really closely with at least 2 or 3 of them, and I'd be happy to put people in touch because they would much rather go to an employer and say, hey, if you're going to have a food truck in the parking lot and bring their bikes along and let people just test drive them out, they'd much rather do that than sit in their shop and wait for people to come in on an off chance that they might to look at a bike. So if anyone's interested in doing that, feel free to send me an email, and I'm happy to put you in touch with any of those contacts.
That's great. Yeah, that sounds really good.
So there was a question that was asked about, there was a graphic showing the U.S. was the most dangerous for cyclists. Why is it strictly infrastructure? Either Phil or Brett can answer that.
I think that was my slide. Let me track down the slide here quickly. Is this, oh, no, that's not. This one?
Yeah, I'm not sure.
I'm assuming based on, okay, yes, I'm seeing yes. Yeah, that's absolutely it. I mean, you have fewer people riding, so people are less accustomed to seeing them out there on the roadway. And you also have bicyclists in the U.S. are expected to fit into a transportation system that was not designed for them. Where you have in Europe, you have a place for pedestrians, a place for bicycles, a place for cars. In the U.S., you have a place for pedestrians, you have a place for cars, and then bicycles kind of fall a little bit in the middle. And people always ask me, well, why do bicyclists break the rules so often? And they do break the rules, but actually they break the rules of the road about the same rate as drivers. But they're breaking the rules out of a need for safety, because a lot of times if they're on a 40-mile-an-hour street and there's no safe crossing or no way for them to make a left-hand turn because they have to cross 2 lanes of traffic to get into a turning lane, they're fitting into this system that wasn't designed for them, and that's a lot of the reason why you have so many accidents here with bicyclists. If you look at photos in Europe, you probably see pictures of people riding without helmets all the time. They ride without helmets for 2 reasons. One, they don't have to because they're protected, and number 2, they don't have to keep up with cars. They can ride at their own pace, at their own speed, and probably the most dangerous thing in terms of accidents between bicyclists and cars is speed differential. So most people feel compelled, like, I have to stay at the speed with cars because it's safer, and it is, but if you crash, even if you're not hit by a car, you're going at a higher speed, so you need to have a helmet on. So yeah, there's a lot of factors, and really the infrastructure is really the key piece. I mean, that's the key piece in terms of keeping people safe and in terms of getting more people riding. I hope I answered your question.
Yep, thank you. All right, so if is there any other questions? We have a couple more minutes.
Yeah, this is Tiger Funk at Southern Utah University in Cedar City. I've got a couple of questions, if you don't mind. First of all, being a part of higher ed, I haven't heard any mention of higher ed, and it seems like higher ed is a great opportunity to deliver this message, because here you've got a demographic of younger people who are perhaps more inclined, but maybe more importantly, it provides an opportunity to really change lifestyles early on and get them into the habit of riding early. So I'm just curious what kind of work has been done at higher ed campuses. And then the other question is, what kind of work is being done off the Wasatch Front? And you know, Cedar City, we've got a few bike trails, but they're kind of disjointed, and there's not a lot of interconnect. But in my view, it seems like a smaller town is the place to start building trails early before the population and the vehicle infrastructure grows to the point that it becomes a challenge to incorporate alternative means of transportation. It seems like it would be better to start that process early on while the town is small versus waiting for it to grow.
Mind if I jump in on this one? I could not agree more on this one. We've actually heard from a lot of our local health departments. They say, you know, we really don't need to be talking about active transportation. I mean, we're a small town. There's like maybe, 5 to 10,000 of us or less. You know, it's just not as much of an issue. I actually gave a presentation to the CDC about the difference between rural and urban infrastructure development for active transportation, and I called it, but where do I tie up my horse? And that was actually a comment that came from one of our local health departments in the Vernal area. What we're actually finding is that there may be more of the user demand in more of the urban areas, but we find that the ease of access of getting it implemented is dramatically different and so much better in some of our smaller locations. Right now, we're working, when I say we, there's a wide range of groups coming together in a Planners for Health project, and we're actually going to be next Monday in Cedar City to talk about how we can connect planning and engineering and public health a little bit better, specifically around areas on active transportation. So you're right. You're absolutely right. And we're hoping that we're going to be able to get some traction that way. Another thing you were mentioning was getting the higher education, particularly when you get linking people, a more younger population, into utilizing the resources. And we've been really lucky that a lot of our universities have been really I would say a forefront on making sure that the pedestrian and the cyclist are prioritized over the cars, mostly because of parking issues, but it also becomes a quality of life, and we've seen that be a draw for a lot of the incoming students because they feel like they can get where they need to go as opposed to relying upon a vehicle for their transport. So, and this is some of the things that we're presenting in various places through urban planning as well as through family and consumer studies and a couple other departments, at least at the University of Utah, to kind of get on the ground school. So a lot of our new planners and engineers are thinking this way as well.
Okay, very good. Thank you.
Okay, have a couple more minutes. Anybody have any other questions? All right, I appreciate everybody's time, and this has been a great webinar. I appreciate the work of Brett and Phil with their information they provided us, and we'll look forward to the next EBTR webinar and sometime in September or October. More information will be given out at a later time. Thank you for your time. Have a good day.
Thank you.
Thank you.
Thank you.